Okay. All right. We're watching. Good afternoon, everybody. I'm just kind of letting the attendee list tick up, make sure everybody gets in before we kick this thing off. Usually it takes a couple of seconds for everybody to get in, I think. Okay, we're approaching 100 on the attendees, so we can go ahead and get started. Welcome everybody to I don't know what edition of the Insights Over the Lunch Hour this is, but it's many down the road. We've got many behind us in our wake now, but just another edition. We like to do these after every council meeting so that we can update on everybody on what proposed, adopted, just kind of things of interest that occurred during the council meeting. And then this one's particularly special in that it follows the 89th legislative session. So we're going to give you an update on some of the bills that we were tracking, some of the bills that passed, some that failed, and just be very brief. And then, of course, we'll do what we've traditionally done, and that is open it up for Q&A so that anybody can ask us questions. Now, just a reminder, I can already see from the audience listed a lot of your frequent flyers to these things, but if anybody's new, when we get to Q&A, you can ask us anything you want to, except for two areas, and that is pending applications and pending complaints. We are not going to answer questions on those for obvious reasons, and we'll handle that offline, or you can reach out to us through the contact us page, but we're not going to do that here and now. The normally, or I think in the past, a lot of you have seen that we had the Q&A forum down at the bottom where you could type in questions and we would type in answers or respond online. I've had that turned off for the past few leadership listening hours. I'm not going to turn that back on again because what we find is that when you have that on, nobody wants to actually interact with you on the screen. You can't actually talk to anybody. Everybody just wants to type in their question either anonymously or it's a fire and forget. That's not as good for us. I don't think that's as good for the public either. So we are not going to use that function. So if you're wondering where that is, it ain't happening. If you got a question, you're going to have to raise your hand and talk to us. So, which isn't too bad. None of us yell, none of us bite. So don't worry about it. But with that being said, let's go ahead and get going. Of course, I'm Daryl Spinks. I'm the executive director for BHEC, and we have here today Mr. Robert Romig. He's the deputy ED. We got Patrick Hyde, our general counsel, Ms. Sarah Fassholz. She is the board administrator for the social work and MFT board. We got Ms. Christina DeLuna, who is the board administrator for the LPC board. And then, of course, Ms. Diane Moore, who is the board admin for the psych board. If you've been here before, you know we're kind of the six that you always get. So let's kind of get going. So the first thing I want to talk about is not something that happened at the board meeting, but it's something that's upcoming that I want to put it on everybody's radar. If you've paid attention at all in the past, you've heard us talk about the switch or the coming usage of CE Broker, which is an online CE management system. I want to go ahead and kind of start plowing the ground and getting everybody used to. That is going to be a system that we go live with, the CE Broker online system. We will go live with it on September 1st. Now, it won't become mandatory until January 1st, but what I would recommend, and you're going to see some invitations for training and education outreach from us and from CE Broker in the coming days and months. I would encourage everybody to get signed up for one of those training courses so that you can kind of get used to and see what the new what your account on CE Broker will look like. Now, it's a free account; it doesn't cost you anything. There are upgrades that you can purchase on CE Broker, and I mean, I think probably we'll get CE Broker to show you what those are. They're slick. They make it a lot easier for handling CE, but you can do everything you need to do with the basic account. It would basically operate like you do now. You're going to have to just kind of manually tally. I've got this number of ethics hours. I've submitted this number. It's still a lot of manual calculation on your part, but it's stored electronically for you, where you don't have to keep track of paperwork anymore, and it makes it easier for us to access in terms of audit. So, but we'll go over all that once we get into those training sessions. But just be on the lookout for email invitations to attend webinars. I think we're going to have CE Broker at the council meeting in October, and probably at all the board meetings coming up in the coming months as well. They're going to give presentations at each of those specific board meetings. But now whether or not you have the Q&A opportunity at the board meetings, probably not. If you want that, you're probably going to have to attend one of the webinars, that dedicated webinars that we put onto the training, but be on the lookout for that. So with that being said, let's go ahead and jump into the rules. The rules, as far as the proposed and adopted rules at BHEC this time, there really weren't too many. We had 3 proposed rules. I'm not going to spend any time on the proposed rules here because most of them were not, honestly, they're just not that much, not of any significance to a lot of the licensees out there. A lot of them are just kind of cleanup or little procedural or administrative changes that we have to make in the system. So if you want to know what they are, as soon as Robert gets them put up on the rulemaking page where you can review them, the preambles, the changes, and you can submit your comments, do that. I don't want to waste anybody's time here because there's no monsters hiding in those rules. They're pretty bland and benign. Honestly, kind of the same thing goes for the adopted rules. We had 88250, which is a continuing education and audits rule. The only thing that change does is makes it clear that we can authorize you to use CE Broker. I mean, we could do it before, but I just wanted to make it crystal clear. That way, nobody could jump up and say, well, you can't tell me I have to use it. Yes, we can. There's a rule that says we can. So, um, and candidly, there's a statute now that requires agencies to do this. So we were a little ahead of that statute, but nevertheless, we have a rule in place now that says you're going to have to use CE Broker or whatever other dedicated online management system we adopt. 88410, which is an adopted rule, is the investigation of complaints. This change, while candidly, most of you, I feel like probably most of you will never have any kind of interaction with the rule, but for the few of you that maybe do some things, life coaching, something along those lines where the line or the boundary between life coaching and what you do as a licensed professional is blurred or it shifts a little bit like a riverbank, then you're going to want to pay attention to this rule change. Basically, what it says is that there is a presumption that you are operating under your license. If you are doing something that could be covered by your license, there's a presumption that you're operating under that license unless you do some very specific steps to, how would you say it, Robert? Not
Like disclaim.
disclaim, yeah, to disclaim that you are operating under your license. So if you're doing life coaching and you're a psychologist and you're like, well, I'm really not operating under my psychology license, then you need to be very clear with your patient. There needs to be some very clear informed consent. And it cannot be something, you cannot just call something life coaching to escape licensing requirements. If you're doing so, if you're administering the MMPI, that's not anything a life coach needs to be doing. That's something that only you licensees can do. So you can't just disclaim that and say, well, I was doing that as a life coach. We're going to be like, no, that's not how this works. It is meant to really say, if what you're doing walks like a duck, sounds like a duck, it's going to be considered a duck unless you take some very, very clear steps. And so that everybody involved knew that, oh, it wasn't a duck, it was a goose, whatever. So take a look at that rule. Um, I don't want to beat it to death here today because it's kind of for it to make sense, you would almost have to have a factual scenario to apply it to, and those things are infinite in variety. So, but take a look at it, study it. But that is what it is meant to do, is to make it give you a measuring stick to gauge whether or not, hey, is what I'm doing a license or a regulated thing, or is it an unregulated thing? So take a look at that. And then the last rule change that we adopted was just a minor, we repealed a fee, a $10 fee for some state verifications. I can guarantee it didn't affect any of you because the reason we repealed it is because nobody was doing it. So we weren't getting anything off of us. We just repealed the fee altogether. And that's it. So other than that, the rest of the changes really occurred within the member board areas. I'm going to let Robert explain all that to you. Robert?
Absolutely. And they're similar. There were not that many rule changes at the board level either. Many of you probably suffered through our rule review process last year, and so we got a lot of that cleaned up already. But on the adopted side, for each of the boards, the council did finally adopt the changes to the continuing education language regarding the distinct populations, the new language there for distinct populations. That was the main rule adopted. On the psychology board. A new definition of the scope of practice for school psychology was adopted. It does not change or expand the scope of practice, but was just fleshing out the full sort of description of what school psychologists can do, lining up with the national standards that have been there for a while. And so there was a request to just, our rule was a little short and truncated and didn't contain everything, so we fleshed that out. And then on the professional counseling board, the only significant rule change there was we repealed the expiration date for supervisor training courses. So some of you may have had frustrations in the past where you took a supervisor training course and either you took it in school and then it expired after 5 years, right when you were coming eligible to become a supervisor. The board ultimately, after lots of feedback from folks, partly the rule review process, decided to repeal that. So now if you have taken a supervisor training course, whether in school or somewhere else, it will not expire. You can become a supervisor. Now, I will give you a caveat. If you are one of the unfortunate folks who have your supervisor status revoked later, you will have to go through that training again. But that'll be a separate rule language. So that's really all on the adopted front. On the proposed rules, I won't go through each individual one for the boards, but just some highlights. For each of the boards, we are aligning language that when you have a client who is already working with another mental health professional, the rule is now going to be the same across all 4 boards, that you have an obligation to try to get consent from the client to notify that other provider and strive to have a professional relationship with each other. There's not a lot of obligations there. It's not that you have to agree on everything. It's not that you have to form a treatment plan together, but we wanted each of you to have a similar obligation across the professions to try to work together when you're both providing mental health treatment to a client. The other rules that are being proposed are really cleaning up some of the supervision language, to make it so that it's clear if you have a supervisee, if you have an associate that's working for you, if they have a complaint filed against them, they need to submit that to you, because you as the supervisor might be responsible for some of the conduct as well. And hopefully as a supervisor, you can help them figure out how to get better and fix their mistakes. Similarly, if you as the supervisor do a remediation plan for one of your associates, or if you're an associate and you get a remediation plan, if the associate then goes to a new supervisor, they need to give that remediation plan to the new supervisor. The new supervisor is not obligated to follow it. They can disagree, but they need to have that information. So those are really the proposed rules. For our social workers out there, you're going to see the biggest set of proposed rules, and those are really changing, reorganizing the 400 rules, which are the license application rules and supervisor rules. Not a lot of substantive changes, but we got a lot of feedback that the rules were too long and too confusing. And so it will look like a lot of changes, but really it is streamlining and making each of the rules more condensed into what you need to know. So hopefully those will be a lot more clearly written and clearly easy for you to access. So those are the big things. As Daryl says, we'll post those rules very soon, and so be looking for that, and would welcome any comments or feedback you have on those. And that brings us to the next topic, is the legislature. So I'll turn it back over to Daryl.
All right. And, just a reminder to everybody, if you're wondering, well, why, and here it is, we're at July 16th. How come we don't have the rules that were proposed at the BHEC meeting already up on the website? remember, as part of the rulemaking process, we have to send all proposed rules over to the governor's office for informal rule review before actually posting them. So that's where we're at in that rulemaking process. They're sitting at the governor's office right now, awaiting review. But I think we've got a meeting with the governor's office scheduled for this afternoon to discuss that very thing. So hopefully this week we'll have that stuff posted. If not, it'll be soon thereafter. All right, so talking about legislative happenings and goings on. So the big thing for us at the agency, of course, the primary bill that we always watch is the state budget bill. And so SB1 was the bill this year that carried the state budget. It alternates between the House and the Senate every year. This year it was the Senate bill. Next year it'll be HB1, will be the budget bill. But at SB1 this year, basically we had requested baseline funding plus money to do NPDB background checks, money to design a new psychology licensing exam, money to fill 6 vacant FTE positions. And then I had also requested some rider language to cover any kind of judgments that were money judgments that were entered against the agency as a result of the agency defending a statute that the legislature had passed, not a rule, but a statute. And in short, the legislature gave us, was very generous and gave us most of what we asked for. They appropriated money and, our baseline budget request, which is basically our budget from last session. They just carried it forward and say, okay, here's the same amount of money. And then they also gave us money they gave us $400,000 to do the NPDB background checks, which is the National Practitioner Data Bank. We are supposed to be running those every renewal for you guys, but there's no way to do that unless you do what's called a continuous query through NPDB. And so it was a physical impossibility to do it. So we had to go ask for money to actually subscribe to the continuous query program through NPDB, which that was given to us. So we're in the process of setting that up. The legislature also gave us $125,000 to design a new psychology licensing exam. Now, when I say design, I'm not talking about develop and deploy it. And I'm not talking about, I know what a lot of people hear is, especially from Psych World, because there's lots of rumors that how this gets started, I don't know, but rumors get started that, oh, we're designing something to take the place of the EPPP, and that's wrong, wrong, wrong. I can't say it any plainer than that. We are not designing a new test to take the place of the EPPP. It is an alternate exam. Because there are some legitimate concerns about the EPPP maybe weeding out people that are otherwise qualified to do it. And when you're in a workforce shortage, that's not a good thing. Whenever you're weeding out people that are most likely qualified to do it, you don't want to be weeding those folks out. So we are in the beginnings of setting up, exploring how to design the test. That's something Robert and I, we've got a meeting with on Friday. We're going to go to we've already started kickstarting the ideas, but the ball is starting to roll now on that. And that'll be something, again, like I told you, to be on the watch for email invitations for CE Broker. Those in Psych World, you're going to start seeing in the future, you'll see some emails go out about, soliciting input on helping us design this new exam. If you want to take part in it, there'll be opportunities to do that. If you don't, then you can just ignore it and go on with your life. Excuse me. But that's something that we've begun. And then lastly, we also they gave us half the funding we had requested for the 6 vacant FTE positions. So what we're doing with that is we are certainly going to hire 2 new attorneys, because that is the area of the greatest need in the agency. Investigations, they go through the investigators, and then what we're finding is they sit longer in the attorney's offices because we've only got 4 attorneys working these cases, and we'll have 600, a little over, I don't know, what is it, Cap Patrick, a little over 600 cases pending at a given time. So, which is a lot for 4 attorneys to be handling, to be honest with you. I mean, our attorney workload is over 125 cases per lawyer, I think, and that's a lot. So we're trying to get that number down. I think probably some of the new things we've implemented that Robert and Patrick had come up with on the enforcement side, sending out preliminary investigation notices, that kind of stuff has helped. But in essence, we need to throw more bodies at it. more attorney bodies at it. So that's what we're going to try to do there. And we're also making a few other changes on the licensing side with some of that money that they gave us, but um, trying to put it to good use. And then lastly, the legislature did give us the rider language that I'd requested in the event we are sued and we lose and a judgment is entered against us while defending the validity of a statute, then the comptroller will pay that. So that's neither here nor there for any of you out there, but it's a big deal to us because a money judgment like that can have detrimental effects on agency operations. You can literally have to cut staffing. A lot of stuff have to go in order to pay that type of a judgment. So it could be disastrous. But then lastly, the legislature did something that I've never seen done before. And while there had been a request early on the House side that money be included in BHEC's budget to uh, create or develop a Spanish language social work exam. And it didn't end up making it in either the House or the Senate bill, but when our budget came out of the conference committee, which is the joint committee between the House and the Senate to reconcile differences in the budget, all of a sudden there was $200,000 in our budget that said you are to use this to develop a master's level social work licensing exam or in Spanish, a Spanish language licensing exam for the LMSW, and it needs to be deployed by September 1st of 2027. Well, that hadn't been in any one of the bills, so it was a surprise to us. So we are, we're working to try to see if we can implement that and get it going. Uh, certainly it can only benefit the state. I'll just say that. There's nothing bad about it. It's just it's difficult to implement, especially much like any of these other exams that we talk about, the EPPP, the NBCC, the whatever the AMFTRB exam is called. We don't own any of them, so we have to work with the exam owner in order to get access to that exam to make any kind of changes. If you're going to translate the exam, we're having discussions about, well, can you just translate an exam, or you have to develop it from the ground up in whatever the native language is that you're talking about. So that's a lot of the discussions that we're having now. So that was pretty much it on SB1. That's the big one for us now. Now that I've yammered on for that way too long and bored you all to tears, I'll get into the stuff that probably y'all care more about. House Bill 12 had passed. It's effective in September. It doesn't affect y'all directly, but it does affect the agency in that it imposes an efficiency audit on the agency. So I had misread the bill. I'd been telling the council and several other people, I'm like, oh, we got to go undergo this efficiency audit every 2 years. But Robert and I were talking. He was like, no, it's only 2 years prior to your sunset review. So, 4 years prior to our sunset review, the SAO will have to select us for an efficiency audit. And then within the 2 year period after we're selected, we have to undergo this efficiency audit. What they're going to look at, I don't know. None of this is set up yet. The only reason I bring it up is that type of an audit has the potential to make some pretty big changes because think of it as a mini sunset review because that's really what it is. And then again, y'all won't feel it, but then 4 years after we finish the efficiency audit, we get to undergo sunset review. So that's going to be a fun, 5 or 6 year period there for us. Note the sarcasm in that, but that's going to be a lot of work. And we undergo sunset in 2033. So starting in 2029, we're going to get cranky. So you'll just have to bear with us in that because it's going to be kind of a rough spot undergoing all those audits. House Bill, I need my glasses almost. House Bill 149 by Capriglione is an AI sandbox program. And the only reason I mention this is because I know the use of artificial intelligence in the delivery of mental and behavioral health care is a big deal. A lot of people are focused on it. Some people are worried about it. Some people are looking about how they can use it more. And what this bill does is it basically creates a safe zone where entrepreneurial types, big money, venture capital, if you want to develop a type of program that actually delivers behavioral health care through artificial intelligence, the ledge has set up a way that they can do it safely without it just being free reign. And I think what the legislature was doing is saying, look, we know this is coming and it's going to be hard to keep our hands on it. So we're going to just set up a sandbox program. to try to entice people into that where we can monitor it. And basically what it says is, if you want to do that, you can do it, but you're going to be under the watchful eye of DIR, who is going to look at the tech side of it. And then you're going to be under the watchful eye of BHEC, who is going to look at the healthcare side of it and see. Both of them are going to have to agree that whatever AI system you develop is going to be safe and is not going to be harmful to the public. So there's still some measure of regulation on it, but they get to do it without any kind of there's reduced liability or limited liability, and they don't have to worry about licensure laws. So their AI system doesn't have to be licensed. I don't think they were going to have a licensed individual on staff. Now, they would be absolute fools to not have licensed individuals on staff to help them develop, because otherwise that's going to be a big red flag for us when we're looking at it. But my point being is, I think you're going to start seeing a lot of money pour into the state in developing that area. And I think the legislature was trying to get their hands on it ahead of time so it didn't like get completely out of control and away from us. And then they're trying to claw back, stuff that is already out in the wild. This way they can kind of control what is released into the wild. So I think that's where they're going there. House Bill 229. Now, this may affect some of you that work in governmental agencies, but it's by Representative Troxclair. It restricts if you're collecting vital statistic information, you can now only use the male and female sex designators, nothing else. I think it would be fine, and we're going to continue to include like a prefer not to disclose in addition to male and female. But I think that's fine. But just be aware of that. House Bill 2340 by Metcalf. This one, if you do child custody evaluations, there's an initial and continuing education CE or training requirement that you're going to have to do before you are qualified as a custody evaluator. So if you do custody evaluations, you want to pay attention to House Bill 2340, because that's going to change your qualifications. The bill also had some language about restricting access to evaluator records in certain instances. I can't remember the details of it now. It's been too long since I looked at it. But again, if you do custody evaluations, you want to look at House Bill 2340. House Bill 2598 by Representative Button, it changes the licensed specialist in school psychology, or the LSSP. That's no more. It's now just a school psychologist or a licensed school psychologist. It's a title change only, and it doesn't affect the substantive scope of practice of anything. But now, what LSSPs used to be, they could use the title school psychologist by rule that we had done, but now it's been changed in statute. So we're going to have to go through psych. You're going to see some rule changes from this. You're going to see a lot of changes on the website in terms of FAQs, forms. That's where it's the biggest pain in the backside for us, is just, scouring our website, scouring our forms, FAQs, and making all those changes. But if you've got any kind of reference to the LSSP in any of your information out there, schools, licensees, come September 1st, it'll need to change to, school psychologist or licensed school psychologist. I think what we're going to recommend the council go with is licensed school psychologist. LSP will be the abbreviation. House Bill 3512 by Capriglione is an AI training module. It won't matter to y'all, but for staff and appointed board members, we're going to have to do AI training. House Bill 3801 by Representative Orr. This one creates the Health Professions Workforce Coordinating Council and abolishes the statewide Health Coordinating Council. I think, I don't know, I'm just spitballing here, folks. So I think what the legislature was doing is saying, well, the statewide Health Coordinating Council had kind of a very broad mission or charge statement. And what we're really interested in is focusing on workforce issues, since all these professions, all the healthcare, behavioral health, and healthcare professions have a workforce shortage. And I think the ledge is like, we need y'all to focus on that. And so they created this Health Professions Workforce Coordinating Council. Now, the reason it's important to us at BHEC is because we were actually not a statutory member of the statewide behavioral health or statewide health coordinating council. We are a statutory member of the Health Professions Workforce Coordinating Council. House Bill 5195 by Capriglione's modernization of agency websites. Now, before everybody, twists off in a tizzy, we are not looking to revamp our website again. I know revamp websites get everybody upset. It's just like when they rearrange the grocery store. I hear it. I get it. You can't find the mustard because they moved it. we're not looking, I don't think we're going to have to revamp our website again. I think the timing of what we did was pretty good in that it allows us to avoid having to do it again. So I don't want anybody worried about that. Uh, House Bill 5196 won't really affect any of you. It just talks about telework by state employees. House Bill 5629 by Wilson amends the military licensing laws. This one, along with Senate Bill 1818 that Patrick will talk about in a minute. Um, it, this one's going to take me, Patrick, and Robert sitting down and trying to combine House Bill 5629 with Senate Bill 1818, and then also combining it with the federal law that governs this. So there's 3 different bills. There's some overlap. It's doable. I actually think it's gonna make things a lot simpler, but it's just gonna be difficult for us to sit down and kind of merge it all together. It's gonna take a little bit of time to do. And it will really, it's only geared more towards the military folks, active duty veterans and military spouses. So if you don't fall into one of those categories, you probably don't care. It's not going to matter or affect you. And with that, that's the end of mine. I'm going to turn it over to Patrick and let you take the Senate bill since I covered the House.
Yeah, so Senate Bill 12 passed, and for those licensees working in a public school, they should really take a close look at this bill and reach out to their schools or their school districts. What this bill focused on is it prohibits any sort of school employee from aiding or assisting the social transitioning in a public school. So the other part of that also specifically to our licensees is it requires some specific consent for any sort of testing or assessments that are outside of the routine things that are done. So that's another issue that they'll need to look at. And it also SB 12 creates a specific grievance process or complaint process in which the schools need to develop if there's any sort of violations of SB 12. So again, this is only specifically in public schools, but if you're a licensee working in that, so it's a school psychologist or a school counselor, you would definitely want to reach out to your school district and your school because this will probably create some changes for you. SB 14 passed, and that was the Texas DOGE style bill. What that does though is it creates a specific office in the governor's office, and so it's not effective until September 1st, but it'll create sort of an efficiency office or agency review office in the governor's office. And so we've yet to see, since it's not been implemented, we yet to see how that'll work. But I believe we work with the governor's office, and so that'll just be another level of them potentially reviewing state agencies. For those licensees with student loans, SB 646 is one that you may want to pay attention to. It was an expansion so the Texas Higher Education Coordinating Board has a student loan repayment program for mental health professionals, and it expanded that program to include more of our licensees, and it expanded the qualifications to meet the standards for student loan repayment. So would definitely encourage anyone with student loans to look at the Texas Higher Education Coordinating Board and see if you're eligible for this, because they try to make it more inclusive of more licensees and make it easier to qualify with SB 646. SB 912 passed, and that was, as Daryl spoke about it earlier, it's the bill that requires agencies to use online CE management systems, and so the use of CE broker now is required by that. So we thankfully were ahead of it before it happened. So that's moving forward. SB 1080 passed. It deals more with it deals specifically with criminal histories and the denial of licenses with it. It really, to me, just gives agencies more flexibility. Currently, or previously before the bill, because it was effective immediately. If a licensee was ever convicted and sentenced to prison, it was a mandatory revocation. This SB 1080 says if they were sentenced to prison for a crime that relates to the duties and responsibilities of the licensee, it's still a mandatory revocation. But if it does not relate to the duties and responsibilities, the agency can still revoke the license. They're just not, it's not a mandatory revocation. So that's sort of one of the big issues I think that comes up with that bill. There's some other things that deal with other provisional licensing for people with convictions, but that's one of the main changes that I think that Senate bill will change with the agency. SB 1188. This one deals with AI and the use of AI in diagnosing or determining treatment for clients and patients. There's a lot that was done with this bill, but the big takeaways I think for our licensees are, if a licensee is using AI, they have to disclose the use of the AI, and that if they're using AI, they also need a human eyes reviewing whatever the AI work that's being done with it. SB 1401, that created the Texas Mental Health Professions Pipeline Program. And so this is another Texas Higher Education Coordinating Board program that they're trying to develop to essentially get more people into the profession. And so the hope with this is they're identifying programs that are like junior college programs, where they're able to easily transfer those credits into a 4-year bachelor's and then into a program for a master's, into potentially one of our license types, as well as there's other license types. I think like nurse practitioners, I think, are also included, but it's also, professional counseling, social workers, psychologists, marriage and family therapists. So it's hopefully it's meant to hope to create a better pipeline, a better pipeline for people in schools to transition to those programs that will lead to licensure. The Senate Bill 1818, Daryl talked about previously. That one specifically talks about the issuance of a provisional license to a military applicant. And that will also go along with the other House bill that talks about some of the using military service and qualifications for licensure, specifically for military applicants. So it's not for everyone. You have to be active military or military spouse, but we will need to make some rule changes on those, and so they'll be coming. But it will be some significant changes. It's hard to pinpoint all of those right now. Also, SB 2587 passed, and that finally put in the LPC statutes the term LPC associate. So that's codified in statute now specifically, and it also specifically secured the statutory authority for us to run criminal history background checks on LPC associates. So those are it really doesn't change anything for most of you, but it just codifies what makes sure that it's in law for us to do those, to issue that license and to do the criminal history background checks for them. And SB 571 is another bill that passed, and the short of that is to tell everyone that the mandatory duty to report child abuse under the Family Code to 261.101. There's a change. Currently it says 48 hours, and it's now been changed to 24 hours. So that's something that's important that all licensees note, that that standard in the law has changed. SB 571 did make many other changes that they mainly deal with a lot of school districts stuff, but that's the important thing is the change from 48 to 24 hours that licensees should know about. And with that, I think that's the end of the Senate bills that actually did pass.
All right, thanks, Patrick. And that, just so everybody knows, check your emails because I just sent out an email, I don't know, 30 or 40 minutes before we started this about SB 571, just so that you guys could pull up the bill and look at it. I put a link in there to the bill and I told you where in the bill to go. It's section 1.30 of the bill. You go in there and look and you can see the change from 48 hours to 24 hours. It's a long bill. It's 50 or 60 pages long. So if you can't find it, just do Control F and look for 1.30, and it's the only thing that'll come up in it. So it's an quick, easy way to find that part of the bill. All right, with that, I've got the raise hands feature turned off right now, but let me turn it on and we can start taking some questions. Robert, ladies, did y'all have anything you wanted to add?
Did you want to talk about the failed bills at all, or not really?
Oh, yes, yes. I'm sorry. Forgot about that. Well, you guys can go ahead and start raising your hands if you want to, but it's just, this is why I keep everybody around, because I'm old and I forget what I was going to talk about. The bills that didn't pass that I know everybody's interested. Obviously, the counseling and the social work compacts did not pass. So there is nothing. Don't write BHEC and ask us to bring those back up. There's nothing we can do about it. You're going to have to contact your respective state associations. They're the ones that kind of carry the water on that. And they find the bill authors and they're the ones that can advocate. The most we can do is kind of be a resource witness for the legislature on those. I'm just going to talk candidly about that. I mean, this is now year 2 that counseling compact has not made it. It's the first year for social work, but there were no compacts that made it this time. I think the cosmetology made it, but I think Abbott vetoed it again. And I haven't looked to see what his reason for vetoing it this time. The first time was it was a brand new compact. We didn't know what we were getting into. We're not going to marry somebody that we don't know, is basically the reasoning for the first veto. I don't know what the rationale for, I haven't seen his veto statement on the second one, but that's a pretty strong indication that compacts are out of favor in the legislature and the executive branch. I have some suspicions for why that is, but I honestly don't know what's going on there. Senator Sparks had a couple of really good bills that I liked. One was mobility endorsement. The other was a telehealth registry bill. I really like the telehealth registry. Both of those bills were modeled after what Florida has been doing, and neither one of them went anywhere. So, you know, kind of disappointed in that, but it's life. House Bill 1716 and Senate Bill 469 by Representative Darby and Senator Sparks. Senator Sparks was a big champion for mental and behavioral health this year. But it was a Medicaid reimbursement for associates. It died in Senate Health and Human Services Committee, made it out of the House, but died in the Senate committee. House Bill 4721 and Senate Bill 51, which is by Representative Romero and Senator Zaffarini. It's the repeat of, I can't remember the bill numbers from the past 2 or 3 sessions that it was filed, but it was kind of MFT, social work, and LPC cleanup bills is what it's kind of characterized as. Those didn't go anywhere. Senator West had Senate Bill 1081, which is establishing or creating the Art Therapy Board. That did not make it, obviously. House Bill 11 did make it. We were cut out. House Bill 11 was an omnibus reciprocity bill. In other words, it would have given BHEC, along with virtually every other healthcare agency, the ability to enter into reciprocity agreements with other states in the union. I didn't go to it. Robert actually went to the hearing on it or watched it. And at the hearing, they cut everybody but TDLR out of that. Why? I don't know. Again, this is one of those weird things. I think some of it stems from they just want to make sure on healthcare, they want to make sure that they have tight control over the standards for what, how people are coming in. I think that's generally what it is. I don't think it's anything nefarious. I think it's just if their constituents' lives and health are at stake, they're going to be extra, they're going to wear belts and suspenders. They're going to be extra cautious. I think that's what it boils down to. But that's just me spitballing. So I was a little disappointed because I've got reciprocity authority for psychology. I do not have it for the others. And I thought, ooh, here's my chance. I'm going to get it all. I'm going to get it for everybody. And it got jerked out from underneath us. So I was pretty disappointed in that one. Senate Bill 268, which none of you will ever have anything to do with probably. It deals with basically, if an agency receives a complaint involving the licensee of another agency, you can't investigate it and prosecute that complaint. You got to hand it over to the other agency. And I'm like, well, duh. I mean, it's not like I can prosecute a complaint against a physician. The only thing I can do is hit them with a cease and desist. And that's about as, that's about as good as those mailers you get in the mail, the trash mail you get. So junk mail. So, um, that I don't know what to tell you on that one. It's just, I think that bill will probably come back. I think that bill is arising out of a squabble between other professions. It has nothing to do with us. I think we just kind of got caught up in it. But anyway, those are the bills that failed. It actually passed. Governor Abbott vetoed it. I don't remember what his veto statement said, but it was the one that he vetoed that would have impacted us directly had he not vetoed it. So with that, that's kind of the wrap up on the failed bills or the vetoed bills. So let me start over here. If you've got questions, if you got a question, comment, or you just want to talk to us about something, raise your hand. And again, we can talk about anything we've talked about today, or if you just got a practice related question, now's your time. You've got us. We'll treat this kind of like what we do for the leadership listening hour. We'll answer anything except questions about pending apps or complaints. So let's see here. Let me scroll to the top. Mr. Taylor, you have a question for us? Mr. Taylor? Can you hear us?
You're unmuted, but we can't hear you. Might check your microphone setting.
Okay, I'll put you back in the attendee list. If you get it figured out, you can we'll bring you back up. Joni Adams, did you have a question for us?
Hi, yes, I do. So my question pertains to LPC associates who are also employed in a public school setting as a school counselor. And they are wanting to know, and I don't have the answer for them, whether or not they can use their hours in the school setting as a school counselor for direct hours for their LPC.
So that, Christina, jump in if I'm wrong, but that's going to really depend on the nature of what they are doing in their school hours. It is not that school hours are prohibited from being counted, but two things have to be in place regardless of where they are or what they're doing. An associate has to be supervised, and they have to be providing professional counseling services. And so if as part of their job duties as a school counselor, there is some guidance counseling going on, which I know is an old term, but there is an aspect of school counseling that is covered under the idea of professional counseling. And so certainly part of what they are doing, and especially that aspect that they are then talking to their supervisor about and being supervised in, would be able to count. But if it is something that a non-LPC would be doing as a school counselor and not being supervised to do it, then that would not count. Does that help?
Yes, and I have a follow-up question for that. So if we're allowing the LPC specific counseling duties to count for direct hours, I was trying to think through how to marry that permission, for lack of a better way to say it, with the rule about what a record has to contain for a professional counseling relationship, such as, is this school counselor supposed to be getting informed consent? And if there's a divorce, are they supposed to be obtaining the divorce decree? Does that licensee need to also maintain the records and the progress notes for the required amount of time? And if so, how do you do that if it's a school client? You know what I mean? Like all of those things, like the record for the fees, all of those things that you would do in a private practice or an agency setting. is that still the requirement if you're using direct hours as a school counselor in a public school setting?
Yes-ish. I don't,
I know, it's hard to
Yeah.
think it through, yeah.
Christina, I don't want to steal the thunder. Daryl, if you have specific.
The records belong to the school district, not the LPC associate who is acting as a school counselor. So they are not tasked with keeping those. They're not the licensee's records. They are educational records that belong to the student, and they're the charge of the school district. So that's the answer to that. The billing, you're not billing as a school counselor, or if you do, it's the school's business, not yours. I don't think they are, but if they are, that's the school's problem. I forgot the first part of your question.
Informed consent, then you've got
Okay.
the notes, like the progress notes and the divorce decree, like then that would burden the school to keep copies and files of all of that for the designated amount of time to be within the guidelines of the LPC rules.
Okay. So if the school district has a policy, I think the short answer is probably going to be no, that you don't need like a copy of the divorce decree, because your informed consent is coming through. It's actually in consent to the school district. It's not to the individual licensee, because this is not a private exchange between the LPC associate and the kid. It's an agreement, an arrangement between the child and his or her parent and the school district. You're just the mechanism by which the school system delivers the services. So I think if the school district has a global consent that mom and dad have already signed off on, then that's all you need. I don't think the licensee is tasked with knowing when mom and dad get a divorce. It's different if you're in private practice. I don't think a school counselor is required to know, oh, well, I got to go get a copy of the divorce decree, because again, it's not you consenting, it's the consent to the school district. And we don't have any control over the school district. We can't mandate that level of informed consent to the school district. So the short answer is no, I don't think any of that is required. Now, one thing I would add to this is, who's going to supervise this associate? It's got to be somebody within the school system, because you're not going to have a school system, I don't think, is going to give an outside party access to educational records. Are they? I'm genuinely asking that. It just seems, I would be shocked if they did.
Well, I don't know. I'm confused about how we're laying this out, because if the informed consent is between the student's family or guardian and the school district, and the school district is holding the records, then I guess the school district would have to obtain a release of information for the LPCA to disclose that information to their supervisor
That's
on a
right.
case by case basis for every student, unless you had it built into the informed consent from the get-go. If a school
Correct.
district is savvy enough to do that, I'm not really sure.
That's why, here's what I'm kind of beating around the bush saying. I don't think it's a good idea if you have an outside supervisor with this type of arrangement, because it's going to inject a whole lot of additional requirements on the school district and the LPCA to make sure that his or her supervisor has access. How can you supervise if you don't have access, is where I'm going with it. And the LPCA the records don't belong to him or her. They belong to the district and to the kid. And so you're going to have to get them to grant access to the supervisor, which is why it almost seems like that kind of relationship has to be wholly housed within you got to have a supervisor who is employed or contracted with by the district, not the LPCA just out on his own grabbing a supervisor and bringing them in. If anybody out there in TV land says I'm way off mark on this, feel free to raise your hand and we'll listen to you, but I don't think I'm off mark on this. I see two people raise their hand real quick after I said that. I'm going to call on y'all here in a minute. We'll see.
But
Go ahead,
that
Ron.
I think is the ultimate thing is, it's not that the school counseling services could never count for direct counseling hours, but if that's not why the LPC associate is hired and what their role is at the school, and the school doesn't have any knowledge about the supervision, and the school hasn't ask them to provide that kind of service, then you're getting into dangerous territory. If it is part of their job description to be providing professional counseling services, then this all should already have been thought through by the school district. They should already have been considering informed consent and supervision and things like that.
But if none of it's professional counseling and you're not using it for your full license, then this whole supervisor problem goes away because you're not actually acting as an LPCA.
And I think the one wrinkle to throw into this is the school district is typically only looking for the school counselor certification from TEA. They're not necessarily looking for the LPCS and the LPCA, which is a relationship or that's under our regulatory jurisdiction. So you're starting to mix two different, you're using a different, regulatory structure to gain those supervised hours. And I don't think we're saying you can't do it. It's just you're using a different, mechanism, different system in order to do it.
Okay, thank you. I think you clarified most of what I needed to know about that. I appreciate your time. Thank you, guys.
If you need any follow-up, Ms. Adams, just reach out to us offline. We can visit with you offline if you need some follow-up.
Okay, thanks. I appreciate it.
You bet.
Christina, we can't hear you. Oh, now we can.
Okay. Oh, I was just going to suggest looking at rules 681-31, that basically goes over the different types of practice that a professional counselor would do. So definitely look at that and compare that to what the individual is doing.
All right, Angie Lutz, do you have a question for us?
Hi, yes, thank you. I would just love some insight in general about complaints and investigations with social work licensees. Specifically because I know social workers don't have to do the jurisprudence exam with every renewal, and I'm not advocating that they do. But I'm just curious if there's a significant percentage of licensees who have gone through the complaints and investigation process who were unaware of the rule in question. Is it that they're unaware of the rule or they're aware of the rule? If you don't track that, that's fine. I've always been curious.
We don't track that. I'm just trying to think back. I just signed an order, for example, I just signed an order today. I think it was a social worker for practicing without a license. And I'm like, obviously they knew they were aware of the rule because they'd let their license lapse and continued to practice.
Right.
And so I'm like, well, I know you knew about the rule because you'd applied for licensure to begin with, and then you just let it lapse and kept going. And then, but the stuff like sexual misconduct.
Right. We know that. We get
Yeah.
that a lot.
And I'm like, I don't really
we
care whether
get
they
the
know
not
that
having
rule or
sex
not.
and having dual relationships.
Yeah.
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 Okay.
I don't know how to answer that question.
I mean, I might say two things. One, to your general question, the vast majority of licensees don't ever have a complaint against them, don't ever have a violation. So it is a very small number of your folks who are committing violations. And by and large, if it is, we are almost never taking disciplinary action against somebody for a really narrow, nitpicky rule that they had no idea was a rule. It's not like, I don't think we usually get to somebody and say, hey, under this small subsection, you failed to keep documentation of something specific, and therefore we're going to come after you. It's almost always pretty basic things like you didn't get informed consent, or you failed to provide the client their records when they asked for them, or you slept with a client and
Right.
don't do that.
Okay, that helps. Thank you so much.
Yeah.
I appreciate your time.
Cheating insurance and sexual misconduct and dual relationships. Those are some big ones. I will say this just because I'd done a podcast on it. It's been a couple months ago now. And one of the questions they asked me was like, what are the top 5 things that licensees get in trouble for? And so I looked it up. Oddly enough, I think the first one was like professional, what do we call it, Patrick? Professional, um,
Boundaries,
well, no, it's not like standard of care, but professional, what is it?
professional standards, or
Per- Oh, geez, what is it? It's basically not professional behavior in the
Conduct.
delivery. Maybe you professional conduct.
Unprofessional
Yeah,
conduct.
unprofessional conduct. That's what I'm trying to say. Yes, thank you. That's probably the biggest one statistically that we get, and almost nobody gets. Can't even think of the last time anybody got disciplined under that. Um, and then it was sexual misconduct, boundary violations, those types of things. So it's like Robert said, number one, y'all are very, very, as much as we sometimes, people like to joke about it, I like to joke about it, but we're very blessed in that we have a bunch of very well-behaved professions under regulation here. We do not have a bunch of ne'er-do-wells running amok in society. And so always take whatever we say on the discipline side with a grain of salt, because it's just there's very few of you that actually get in trouble. Um, and the stuff where it is just a kind of a boneheaded mistake, ISC panels are really, really good about saying warning letter, um, go away. You've learned your lesson. We're never going to see you again. And even the folks that do get in trouble, the vast majority are not frequent flyers. We'll never see them again once they got in trouble. They're never going to bubble up on our radar again. So that's just yet further evidence that, on the whole, y'all are a very well behaved profession. So it wasn't quite what you asked, Angie, but
No,
just
I love that insight. Thank you so
a
much.
little bit of insight there. Yeah. Leanne Solmonson, you have a question for us?
Well, I have my original question, and then my hand was already up, so I couldn't be one of the ones shooting my hand up during the school council conversation. My original question is, I've noticed that the last 2 or 3 of my LPC associates that have upgraded have had to redo their fingerprints. Why are we requiring them to have to redo those if their fingerprints are already on file?
I don't know that. Are you sure they're having to redo them?
Yes, and they were told that they could not upgrade until their fingerprints were redone.
It's
Was
it's
this
hard
because
to
of the,
go ahead, Sarah.
was this because of the statutory interpretation that we didn't have permission to get their, as associates at LPC associates, we didn't have permission to get their
That
fingerprint
those
based
would
reports?
they haven't been around long enough to upgrade if that happened.
The last
Oh.
So it,
that I've had to upgrade had to redo their fingerprints. And they got emails saying they had to redo their fingerprints.
Is
so
it redoing it as in doing it completely again, or is it they couldn't get a good read the first time they did it? And
They got their fingerprints done when they got their associate license, and they're upgrading to LPC, and they're being told they have to redo their fingerprints. And I'm not the only supervisor who has commented on that. We've had some discussion in some supervisor groups about that.
Ms.
So I can
Thompson, I can reach
ahead.
out to you directly, and we can kind of see what's going on and all that, if that's okay with you after the meeting.
Okay. Okay.
And I can tell you we are very conscientious of it, but the rules are very strict about it. I'm thinking that what could be happening, there could be a few things. One is there was a period where some associates came through and were able to get in without fingerprints, even though they were required. And so if that happened, if for some reason they were able to get in even if they had thought they'd done them or they didn't, then they would have to redo them. The other issue is if they let their associate license lapse for any amount of time, even if they got all their experience and it took a while before they applied for an upgrade, if somebody is not licensed with us for any amount of time, we are statutorily obligated to unsubscribe from their fingerprints. The FBI requires us to do that. So that could be a thing that is happening. I don't know that it's either of these situations. All I mean to be saying is we if we have at all access, we don't require people to redo their fingerprints. If we're requiring you to redo them, it's because we cannot access any prior ones, and we have to make you go redo them.
Okay, well, the lapse doesn't apply to any of mine. So, the other thing I wanted to talk about was the school counseling.
Hmm.
Daryl, I would say the vast number of LPC associates who are working in the school district are supervised by somebody outside of their school. As a school, I supervise a lot of school counselors. I have school counseling experience. I believe that you're practicing unethically if you are supervising someone that you don't have experience in that area. And so if you're supervising school counselors and you're not a school counselor, I don't believe that that's an ethical practice because you don't understand the nuances of working in a school system. There are certain places I would not supervise people because I don't have experience working in that environment either. I like what Christina said about looking at the approved types of counseling. Although a school counselor can do group counseling, educational counseling, career counseling, if a school counselor is an LPC, those hours should also count because they are approved methods of counseling. If I could do that in my private practice, the fact that I am sitting in a school building doing it should not make any difference whatsoever. The same hours should count if they would count in my private practice. And
How are the supervisors outside the school district supervising an LPC in the school district? Tell me that.
I've never had a school, in fact, I've got 2 school districts that pay me to provide the counseling.
But
And
are you a school counselor?
yes, they are school counselors. I've
No,
never,
no, you.
yes, I am. I'm a school
do,
counselor and an LPC supervisor.
do you work in a school district?
No, I do not. I'm a professor.
Okay.
And I've never had a school district not allow me to have access to what I need to have access to.
And the school district pays you to be a supervisor?
Not all of them, but I do have 2 right now that are paying me. Because they recognize the benefit to their school counselors also having their LPC.
Yeah, I get that. I'm really confused about how you can have access to those FERPA records.
As the supervisor of record, as I said, I've never, and honestly, I mean, there's not a lot of the school counseling records you need to look at. A school counselor doesn't keep records in the same way someone in private practice does for several different reasons. One is because parents can access anything, which I know that they can in private practice as well, but it's parents can even access an email. If I send an email to a teacher and it had a student's name in it, a parent can access that. So
Okay.
the rules in schools are different. So, and if you had to stop and take notes on every student that walked into your office, you're going to be doing nothing but note taking. I mean, it's not unusual to see, 25, 30 kids a day.
Yeah. I mean, I don't think that's what she was talking about, but it's the supervision issue is kind of what I was kind of concerned about. But it sounds to me like what you're saying is the school is consented to you serving as the supervisor.
Right.
And so they've given you access. So in other words, they have satisfied all the concerns that I had when I was talking with Miss Adams.
Right.
Okay. And so they're aware of what you're doing and they've given you access to their records so that you can do whatever you see fit as the supervisor of your folks.
If they
Okay.
put LPC associate on their email signature, they have to have my name on it. If they are seeing a
Yeah,
student,
yeah.
they have to notify the parent that they are under supervision.
You making your associates get divorce decrees?
No,
Okay.
because in a school setting, that is a different
Yeah.
situation.
Okay. All right.
schools are different animals, but we need those people with the LPC training in the school setting too. So I think it can be kind of short-sighted when we're making it more difficult for school counselors to get those credentials. Because those students benefit from that LPC training. And
Yeah.
they benefit from that higher level of education.
Understood.
And that's my soapbox. Would you like me to step down?
We got a few behind you, so yeah.
Okay, thank you.
Thanks, Leanne. Sherry Moon, do you have a question for us?
I heard you talking about reciprocity, and so, but I missed what was being said. Was the social work reciprocity pact rejected in the state of Texas? Has it gone back up? I didn't know, I didn't catch the whole conversation.
Yeah, the social work compact failed. It did not pass. And
Okay.
then that's different from reciprocity, though. House Bill 11 was the omnibus reciprocity bill, but we were stripped out of it. So we do not only did social work compact not pass, but we did not receive authority to do reciprocity agreements with other jurisdictions. So
Gotcha.
you got nothing out of it, is what I'm
And we're
trying
still
to
an
say.
island.
Yes,
That answers my question. Thank you.
you bet. Dennis Scholl, you have a question for us?
Hi, Executive Committee members. Nice to meet you on
Yes,
the
sir.
video. I'm a licensed psychologist down in Somerset, Texas. Can you hear me okay?
Yes, sir.
Okay, Somerset's just barely in Bear County, and a number of issues kind of had piqued my interest because of my well, background. Just about my 50th year postdoctoral experience, much of it in rural areas, 13 in Alaska, statewide, and then another number of years after retiring from the military, serving supervisory roles for the local mental health authority between Eagle Pass and Kennedy, 9 counties south of Bear County. And the thing I'm interested in, especially since there's a unification across educational and training backgrounds that Texas has seen appropriately to come up with, is if there are ways to propose more collegiality, and whether it's collegial consultation or the next best thing probably to supervision, to have folks such as myself as a psychologist being able to work with other professionals, whether it's in a school in a rural area or in a clinic or in a private practice, and be able to work with them, even though my license is in as a psychologist, theirs might be as a professional counselor or clinical social worker or other. And essentially, if there's some mechanism, if there's ways to do that, I've got folks that worked for me at one time in the local mental health authority who would love to have me still be available to them and have it in some ways count or be creditable for them for supervisory purposes. And I'm wondering if we could even have a way to, hey, this is what we propose to do as behavioral health colleagues for a supervisory type documentation and meeting standards, and float it up to the BHEC and see whether or not that measures up. You know, the counties I've served, not only there's a health desert out there, but in particular, there's a behavioral health desert of providers. And frankly, teleservices just ain't the same thing. If we got folks brave enough to be in those more rural areas to try to provide care, we ought to be looking for comfortable, easier to meet ways for them to meet some of those other standards for supervision, et cetera. Just interested in your thoughts about that and feedback. Thank you.
Well,
I've got some thoughts I'll share, but I'll let y'all go first.
that my one thought, I mean, it's not quite what you're talking about, but just from a if you're not talking about the supervised experience requirement for licensure, setting that aside, in all other aspects, we encourage and every profession is allowed to work with and be supervised by each other in terms of work. Now, the clinical judgment has to be within each of your scope of profession, but you can have businesses run by a counselor who employs a social worker or employs a psychologist and vice versa. So there is, at least in the real world and practice settings, we recognize there is lots of cooperating going on. But I think your focus is on the supervised experience question, which would require rule changes.
Yes, so maybe if there's some way to look at the right pace, rule changes / improvements to make access to supervision that meets required supervision needs easier to get. If you get somebody like me, even in my senior age, willing to work with other professionals who need that kind of supervision, is there a way to make it count? That's just.
There was Doc, there was a bill that was filed. It's been, I want to say 2, maybe 3 sessions ago, that would have allowed LPC supervisors to supervise LMFT associates for purposes of licensure. And the reason being is because in this particular, and it was limited to a certain area of the state. And I cannot remember, it seems like it was Southwest Texas somewhere, is Eagle Pass, somewhere's right around there. It was limited because there weren't any MFT supervisors in that area. And so they were having to, the only people they had available for in-person type consultation was LPC supervisors. Now, the bill didn't go anywhere, but it's been tried. That was tried in the legislature, a couple of sessions ago. It didn't succeed. Once upon a time, I think the LPC board used to allow psychologists to supervise associates, or interns is what they were called back then. And then that would count towards licensure. But Christina, is that right? A long time ago. It's been probably more than a decade.
I do not remember that. I began in 2016. So
Okay.
as far as I know, it's always been only an LPC supervisor.
Okay. Well, I'm pretty sure that was the case. They used to allow psychologists to do it long time ago, but then that changed. And now it's, as Robert described, you have to be, for the hours to count, the clinical hours to count, you have to receive supervision from somebody within your own profession.
Well,
and it gets into, it gets into kind of interprofessional conflict there about, well, you're a psychologist, the services you would be providing are psychological, not counseling, or not marriage and family therapy. I totally, I get what you're saying. Just honestly, it would be helpful for the workforce to be able to do what you're saying. I don't know. The only way to know what would happen would be for somebody to propose that rule change and then let's run it up the flagpole.
Yeah.
I don't see that kind of a rule change coming from within the boards or from the staff. I think that's going to be something that somebody's going to have to submit a petition for rulemaking for, if they want us to run that up the flagpole, which there's a mechanism for folks to do that. And it's called the petition for rulemaking.
Maybe I should pursue that sort of thing. I haven't
Yeah.
been a worker and supervisor in the local mental health authority. Internally, they can approve folks to work with people who are in need of behavioral health services, and they get labeled licensed practitioner of the healing arts.
Yeah.
And frankly, oftentimes those individuals, dedicated, empathetic, etc., but much less well professionally developed than those who get licensed under the BHEC. It would seem that we could at least expand the market and perhaps availability to make it more possible to be a professional in rural areas if we had similar type of oversight and supervision. If someone with a bachelor's degree and no experience can be an LPHA, licensed practitioner of the healing arts, and doing case management and other work of a behavioral sort with folks sometimes who are in most need of behavioral health care, then why should professionally licensed folks be more restricted than those individuals employed by state grant funds.
Yeah.
So maybe I'll try to write something down and run it up to Flagpole. I know about Flagpole being a retired military guy. We'll take a shot at it.
All right.
Thank you all for all that you do.
Yeah,
Thanks, Doc.
the only thing I would add just real quickly, just to let him know, is there's two rules that sort of address his issues he brought up, and there's the professional development rule for psychology that does incentivize psychologists providing supervision to supervisees who deliver services in rural mental health shortage areas, and they can claim up to 20 hours in that. So there is some one rule in the psychology board rules to try to incentivize that sort of supervision in shortage areas, but that's specifically psychology only. And the only board that actually does allow some supervision outside of their own is in social work. And if we look at 781-404, none of the supervision will count towards licensure, but 781-404A2, which will be reorganized in the proposed rules, but the current version does allow for a psychologist or an LPC or an MFT to supervise a licensed master social worker providing clinical services. So there is that one where you could look to supervise maybe an LMSW providing clinical services. That would be acceptable, but as long as it meets the requirements of that rule.
If I
Thank
could
you,
add,
Pat.
that's only if the LMSW is not accruing hours toward the clinical license.
Correct. Yeah, those hours won't count, but they can practice that way.
Thank you both. I think one other way to maybe also consider this is that under the ethical standard for all of us, I suspect, to seek consultation from colleagues when you're working, regardless of the cases you're working with, if there's a way to substantiate that those in rural areas have at least done that kind of consultation and you document it, should there be an instance where there's a complaint registered with their board, at least to be able to say, hey, I've met at least the ethical standard to seek consultation. If they seek consultation from another colleague across professions, that might be of some help in y'all looking at their professional compliance with standards, et cetera.
Sounds good. Thank you, Doctor.
Thank you. Good to talk to you.
Natalie Montfort, do you have a question for us?
I do. I just had a question about, I'm a licensed psychologist in Houston. And I had a question about I think you called it an alternative exam for the EPPP. I'm just wondering, I hear what you're saying that it's not a replacement, but can you tell us a little bit if there's ideas about how an alternative would work?
Not yet. That's what we're doing. We're trying to design it right now.
So once it's designed, like let's say we have the perfect alternative, how would it function alongside or as an alternative to the EPPP, I guess is my question.
You could simply select whichever one you wanted to take in Texas. Now, if you chose to take the Texas-owned exam, I mean, unless other states choose to adopt it, it would only, you can only be licensed in Texas based on that, and it would not render you eligible to participate in SIPAC. But you could be fully licensed in Texas.
I see.
If you wanted to, if you thought, well, I may want to get licensed in Oklahoma or wherever, then you would want to take the EPPP, and unless states start. And I honestly, one of the things when we're designing the test, we want to make sure we include other jurisdictions as well, because we want it to be attractive for other jurisdictions to accept. So we kind of want them to have some say and skin in the game in developing the exam, because we want them to say, well, look, I actually took part in designing that thing, so I know how it's made up, I know how it works, and I think it's perfectly safe to use. So it's going to be kind of the approach we take in the design phase. Now, I will add one other caveat. Again, we are just designing the exam. This doesn't mean once we get it designed, we're going to flip a switch and it's going to go live. We're actually going to then have to go back to the legislature and get authority and funding to actually deploy and implement the exam. So just because we get it designed doesn't mean it's actually going to come to be. I need everybody to understand that. This is a two-step, it's the Texas two-step. You know, it's a two-step process. So we got to do this one first. We got to design it, and then we'll go to the ledge and they will decide whether or not they want to deploy it.
Got it. That clarification is helpful. Thank you.
You bet.
And I'll just add for those, if you go out and are trying to explain it to anybody, one useful analogy is think of it like the SAT and the ACT. They both exist. They both work just fine. They're both good exams. Ultimately, you just choose which one is best for you for the circumstances. So
Exactly. Elisa Blanco, do you have a question for us?
Yes, I was wondering if you guys could provide some clarification on what qualifies for a CEU. I'm a clinical social worker in San Antonio, and the health system I work for offers regular trauma-informed care trainings. They do state that the CEUs are for nurses, I believe doctors and social workers. However, when we receive these certificates, it states that they're accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. So it doesn't say anything about social work. I'm just wondering if these, certificates would still apply for our CEUs. I don't want to depend on that if it doesn't necessarily state that explicitly on the certificate.
You said it's being put on by your hospital system that you work for?
Yes. Mhm.
Hospitals are a recognized provider under the 50% rule in the CE rule. So as long as it's pertaining directly to the practice of, are you a social worker? Is that what you are?
Yes.
Okay. Yeah, as long as it's pertaining to social work, then yeah, it's going to count. And it's going to count
Oh,
towards the
okay.
50% requirement.
Staff
Okay.
will,
Go ahead, Sarah.
staff will rely on the title of the continuing education in part to determine whether it's related to social work.
Okay. So as long as it has the health system's name on it, it qualifies as a CEU, is that correct?
Well, yeah,
Qualifies as the provider.
Yes.
right. So yeah, you may
Mhm.
when you're reporting it need to have a little explanation or description if it sounds like if it's the description is something about trauma informed care in nursing,
Mhm.
and it's put on by a hospital and it says it's accredited for nursing, our staff probably will look at it and have questions of why are you
Mhm.
submitting a nursing CE? But if you have further description and course content or things to say, this was really
Mhm.
about all of us in a hospital setting that are doing trauma informed care, that kind of thing.
I see. Okay. That helps. Thank you.
Mr. Taylor, do you have a question for us?
They reached out to you.
Okay, thank you. Yes, can you hear me?
Yes, sir.
Yes.
So underneath the Senate bill that passed for the changing of 48 hours to 24 hours on mandatory reporting of abuse, neglect, we're seeing an uptick in family courts where LPCs or other mental health professionals are not reporting any of this type abuse underneath the statutory definition of abuse, but yet they are sitting in family courts talking to a judge or other court and court or signing affidavits that required into an investigation to law enforcement or DPS or CPS. Is there anything the agency can do to start preventing such act if they're not mandatorily reporting a statutory abuse, but yet sitting in front of a judge without notification to potentially one or both parents?
Well, I mean, if you've got affidavits or sworn testimony or a transcript, then you could submit that as a complaint and we'll look at that and then sanction them if they didn't make the report in a timely manner.
Direct, and I do appreciate that, and I think that that's an adversarial, or I believe that there's conflict with that, and I can only talk about this now because a complaint was submitted and was ruled upon, and that exact thing happened. Although the board did not see that it met the criteria, yet a signed affidavit stated that there was imminent danger to harm, but yet no report to a law enforcement or agency. And in the county that I am in Jefferson County, I've sat on numerous hearings outside of my own case that LPCs or other social workers even have not reported this. And I actually think the mandatory reporting should take place immediately. 24 hours is still one of those things where it still may be a little bit on the timely side, but 48 hours was too long. I think that what happens
Well-
is people start getting attorneys involved rather than getting the actual investigating parties involved.
The other aspect, Mr. Taylor, that I think you have to keep in mind is that you're sort of talking about this failure to report in a court setting. That means there's two things to come into play. I may be misunderstanding, but it seems like you're suggesting should this testimony be struck because they didn't report? And those are two different things. You know, they may have violated a rule in failing to report, and that's certainly something the board would look at. But whether or not the information they provide to the court is valid and used has nothing to do with whether they reported or not.
Topic later.
That's up to the court to
Court.
determine.
And I do understand that. I should have led with this was a two-parter in A and B, and I do understand and respect your position on that, Mr. Robert. However, it may be a statutory violation, although the information may be pertinent. The B question to this would be when another investigative party comes in, whether that be law enforcement, a department, or a child custody evaluation comes in and states that they are contradictory to any of the alleged by that mental health professional, then it becomes an even bigger balloon of problems because the agency or the child custody evaluator potentially or outside mental health professional comes in and states that there's conflicting information that's given to the court. Now the court has already made a ruling potentially. What happens there? See, and I understand that Dr. Spinks is that there's probably an unnumbered amount of scenarios, right, that we could get into. But our issue is in family court is that you have people making erroneous or misleading or false statements using these third-party professionals, and it's a statutory violation, but yet the court sees that it is viable information, and then later it's viewed as false because of a child custody evaluation or an outside evaluation, and now it becomes a whole nother balloon of problems that's not getting resolved, or the department is not following through on their complaints or investigations or holding them to that statutory. I'm trying to clear this up because Texas family courts have become weeded with perjury and allegations of false things, and parents are having to fight against this to keep their kids from being taken by the state or a court order. So I'm just trying to clear up some of this stuff for the people who are watching or people who maybe have dealt with this. So that would be the other thing. The part B is when the courts are misled or a third party finds that there is no imminent danger of harm or abuse, then where do we go from there?
Well,
I mean, as far as the testimony or what is done in court, I mean, cross-examination and the appellate process and the production of evidence to the contrary, that's going to be your best and again, maybe your only option there. To be honest with you, that's outside of our jurisdiction and wheelhouse, what happens in the courtroom. We don't have any say or control over that.
I have respect to you for that. I appreciate you not stepping your foot. Nobody, I think, wants to be in those shoes anyway. However, when it becomes a statutory issue, whenever we're finding that the investigation process is not, the statutes are not being followed, and then the department is not, holding them to the black and white or the statute themselves, then we have a even bigger issue. I'm just trying to get clarity, man. There's for the entire people that are watching, which is several people, is that we're having this issue across the state. And this is not only, you mentioned Florida early. These are other states that are having these same issues as well, where the state agency has a statute in place, and then the complaint comes forward, and then the state agency is not acting accordingly or holding them to it. I just want to have clarifying mobility forward for everybody involved, and especially when there is a violation against the statute, that the court is made aware of it, so that they can actually use that information to whether this truthful or not, or accurate, where they're not making haste decisions, especially when abuse or neglect is involved.
I really don't know how to answer it other than to say, if if you have evidence that a licensee has not complied with the statutory reporting requirements, then you can file a complaint with us, or you can file a criminal complaint against the individual, and both of those are investigated separately from one another.
Yes.
Yeah, I don't know how else to tell you. I don't know what else to say in that regard. That's really all we can do.
I understand. I appreciate your time. I just want to put it on the radar that there are some family court issues and mental health professionals biting off into those areas. And I just want them to be cautious as to what they're doing. They need to follow the regulated statutes. Y'all made a change in the 107, which I think is tremendous. It should not be 48 hours. It should be almost immediately when they know this happens. But 24 is way better than 48. So I hope that statute, along with the child custody evaluators, audio visual, those are awesome things that have now put in place. So I thank you for the time and allowing me to talk through that.
You bet. Thank you, sir.
Yes, sir. Bye-bye.
All right. Showing Lauren McLean, do you have a question for us?
Yes. I just wanted to ask, because I have a LPC associate that I've been supervising for several years. She was working for an agency, but quit working for that agency and went on a maternity leave. She had a baby in November, was going to take time off to just be with her baby. And so she's been doing that, and the plan was for her to return to work in around March-ish. I've messaged her several times and for updates, but each time she states that she is applying to places, but nothing has panned out yet. So she isn't working anywhere, but she has been still under my license as an associate, even though hasn't been working, and it's been.
Lauren, you cut out on me. Last I heard was she's been applying. Patrick, Robert, are y'all hearing her?
No.
No,
Okay.
she just cut off.
Yeah, Lauren, you just cut off. Well, keep working on your settings, but I can give you, we've gotten this question a bunch, and so I can give you a little bit of guidance. Hopefully you can hear us and it's not that you froze up. So generally speaking, an LPC associate can have a break in supervision that just needs to be documented by them and the supervisor. Oh, she's gone. Well,
We're being recorded. Go ahead and answer.
yeah. I'll
We can direct her
finish
to
that
this.
for everybody else. What we recommend is, if there's going to be a break, you go ahead and complete a supervisory experience documentation form for us pre-break, to avoid just this situation where you don't know when it's going to start back up, and what if you lose track of your associate, or what if they lose track of the supervisor. It's always good to just document what has happened, the number of hours, the number of supervision hours, etc. Then once the person starts working again, they then need to be supervised again, and that's when the hours start back and the supervision hours start back. Two important things. somebody who, and here, Lauren, Lauren was there, an LPC associate, just by holding the license is not required to keep working and keep supervising. They have to be supervised if they're providing professional counseling services. And so it is okay for them to leave supervision. It's okay for you as the supervisor to say, I'm no longer comfortable being your supervisor, right? It's just that you cannot be practicing as an associate without a supervisor. So if you need to take a break or they need to take a break, you can have this break. You just don't get to continue to being an associate. I don't know, Christina, you want to jump in and elaborate?
The only other thing I guess I can add to it is a lot of times when we hear this type of scenario, that individual is not going to complete their hours within that 5-year time frame that they have the associate license. Whatever hours they completed in that license will carry over. They'll just have to reapply and meet the requirements that are in effect at that time that they reapply with us. So that's, as Robert said, the big important part is to make sure that you submit that supervised experience form on your side. Lauren, I know you just fell off again, and I'll send you an email. I have your email. But that important part is that the supervisor submits those hours so that we can make sure and get that on file for the associate. So if they do have to reapply, we already have it on file for them.
All right. I got 2 callers I'm going to go through real quick. Let's see here. Caller ending in 3295. You have a question for us? *6 to unmute. I'm going to go quick. So, okay, hearing caller ending in 6723. If you have a question for us, *6 to unmute. All right. Hearing nothing. Okay, that is it. That's a wrap for today. We appreciate everybody joining us. Hopefully you found this helpful, useful in some manner or fashion. Like I say, if you've got any questions between now and the next leadership listening hour, you can always reach out to us through the Contact Us webpage. We're happy to visit with you if we can. If not, be looking for those invites for the CE broker training and introductory webinars, and then be looking for the next leadership listening hour. And then if you want to kind of watch for your next respective board meeting whenever it comes up, because hopefully we'll have CE broker on there to kind of introduce the product to you there as well. But in the meantime, I hope everybody has a good day. Looks like it's a pretty day out here in Austin. So hope you're all having a pretty day, and we will see you next time. Thank you all.